So our first question was that what do you think most people not realize or understand about postpartum depression? The common misconceptions.
Uh, number one is not everyone is well educated about postpartum depression. All right. Many people, they don't have any idea what is depression look like, because they don't have any experience, they don't have any education. So, the more you educate them, it is better. Number one. Another one is stigma is another thing. Many times we have seen, even though they know they've been suffering with a depression, but they are very reluctant to get it treatment. They think what their husband will think, or husband, family will think. Maybe they will think like she is crazy. For those kind of things, like a number one barrier for postpartum treatment.
Okay, thank you. Our next question was, what is the main big thing that you want everyone to know about postpartum depression? Like the single best takeaway that you want them to have from our presentation?
Yes. It is very common and it is okay to have. All right. It's very common, it's okay to have. And most of the people, more than 50% of the people can have some kind of mood problem after delivery. And the good thing is help is there and there is a treatment for them. So I strongly recommend, whoever developed postpartum depression to get a treatment. It can be treated, all right? If you don't treat, then it can cause a lot of problem. People can develop severe depression. People can, we say the depression in a general term, but some people can develop clinical depression, which we call like major depressive disorder. And if you develop major depressive disorder, it will affect your personal life, social life, occupational life. Nowadays, depression, clinical depression is the number one leading cause for disability around the world. So you can treat them, the help is there, and people can be cured after getting the treatment.
Thank you. And I know we touched on this a little bit when we were talking about the presentation, but what can people do, like other than what we've listed on the slideshow, what can they do to prevent or limit their postpartum depression symptoms, like even while they're still like baby blues, for example, or after they've developed into postpartum depression, like what can they do to limit things without medicine?
Support is very important thing. You need to make sure not only the patient, I referring patient members who had baby, knows about postpartum blues or depression. It is also important our other family member also knows about postpartum blues and depression. They need to make sure she get proper support. They need to make sure that they don't make fun of her. Hey, you are crazy. They should give proper support. So the important thing is, with the patient, also you need to educate the family member also if needed.
And then again, we did talk about this, but what can people do to prevent or limit the development of postpartum depression if they have a history of mood disorders? And like we talked about going to counseling, but is there anything else people can do with a history of mood disorders?
Okay, so if anybody has history of mood disorder, you need to make sure they are on medication before the pregnancy. So this is the number one, right? They need to stay on medication. they need to improve their social life as well, like having good social support, then reducing their anxiety. They need to make sure they eat good as well as they have good sleep. And another important thing is they need to stay away from all kind of recreational drugs, like it could be heroin, cocaine, meth, marijuana, alcohol.
And I think that is all the questions that we had prepared. Thank you so much for doing this for us. This is really helpful for going through our presentation
you have
and the
any
questions.
No, that was all the questions. Thank you so much.
All right. No, it is excellent. You did really good, and I think both of you should come at school.
All right. Thank you so much.
Thank you.
All right. Take care, and let me know how it goes, and if you have any question meantime, just let me know.
Yeah, of course. Of course.
Perfect. Thank you.
All right. Thank you. Have a good day.
All right. Thanks.